the first phase with our partners, um, who will setting up some partnership agreements with different healthcare institutions. And then we can see if there are plans to go into more structured arrangements, hospital or hospitals, for example, in Nigeria, similar to the model we've done both in Saudi Arabia and in the UAE. As the second question is concerned, which is a smart grid, this is a model that we have started to reduce. So where the patient, anywhere, even remote, he can access specialist care without the need to go to the hospital. So we try to bring the hospital closer to the patient. And that model is what we're trying to roll out. We'll first, again, work with a limited group of partners, test the model, mature. If it works well, the sky is the limit, as they say.
The other question, the other one in terms of investing, how much?
About this. Thank you very much. Thank you for your question. In terms of the amount of investment, now as you know, as Mohammed explained, right now we are in the first phase of investment, the office itself, and having the presence on ground. Fakeeh did not have presence in Nigeria before. So we as a facilitator and as a company that have partnered with Fakeeh to come and to establish in Nigeria, we have to first show Fakeeh what we have in Nigeria. Taking the decision of investment is based usually on the facts from what we have on ground. And we need to give Fakeeh the full vision of what we have in Nigeria. That's what Dr. Mohammed was saying. So that's what we are working on right now. We are working on collecting data, on having MOUs and partnerships with different bodies in Nigeria, governmental and private sectors. And after that, determining the way of next level penetration will be according to the first level. We are also getting a very good commitment here, excellent commitment from Fakeeh to open the smart clinic in Nigeria. Let us not limit ourselves on the amount of investment. Let's see the impact. Sometimes some hospitals, I'm saying this from my knowledge of close cases in Nigeria, some big hospitals which have been invested hundreds of millions of dollars to be developed are not giving the needed impact from them. So sometimes we need more focus on management, more focus on education, on having smart solutions, because sometimes you have a small smart solution will save millions of dollars in investment. So this smart clinic, we hope that the first phase will succeed and we will have a very good move in Nigeria. Why? Because this smart clinic will provide a magnificent medical consultancy for people in rural areas that we need to invest millions of dollars to reach them. We have 774 local governments in Nigeria. So, thanks to this model of smart clinic that we yet to start in Nigeria, we hope it will work. I cannot say it will work until we have it on ground. But the commitment from Fakeeh to help us get in the smart clinic in Nigeria itself is giving us great hope that we will have the medical services reaching all people of Nigeria. So again, we need the impact. We need to focus on the impact. So from the smart clinic, we can say if it succeeded, and we hope theoretically it will succeed. We hope that practically it will succeed. I am telling you, it will save Nigerians and the Nigerian government a lot of investments.
What is we invest medical knowledge and the way how we teach right now, and that's the investment. We cannot bring it to a dollar, but you bring it into quality direction. And we are here to open the arms and then facilitate fellowships, and bring ourselves here into the sports. Without.
So this is an investment. We all are here. This is the beginning of our investment. You can say. So we brought the CEO came here, chief of our clinics came here, and all four chiefs are here. So our time and our efforts that we're doing, you can see. Otherwise, we could have done it just few staff coming here and not. No, we came here. We saw among the people their willingness, and at the same time, our say effective way of launching Fakeeh here, and then smart clinic talked about. This is just the beginning. This will come the beginning, and definitely we have an intention. That's why we are here. And in future, we cannot again gauge in terms of dollars how much we can make. But again, when we are here, means we are committed. We will do something.
My name is Abdullah Dauda from Click Nigeria, the only challenge of Radio Nigeria. My question goes this: how affordable is this hospital to Nigerian families, and where is it going to be situated?
It's very important. Affordability and sustainability in healthcare is an issue in Nigeria, in the Middle East, in Europe, in the US. It's a global challenge. You need to provide quality care, you need to provide affordable care at the same time. Sometimes care is to provide quality care, it has its cost. You need to make a patient save his life with a tumor in the brain. It has cost. Because otherwise you'll compromise. The challenge is how to manage this, how to manage the costs of healthcare so that you can come up with an affordable model. One of the most affordable models is when you utilize technology like this smart care. You can utilize technology more to save the distance, to save the travel, not only for patients, you save the travel for the providers as well, because this is a cost. So this can bring an affordable care. When it comes to complex surgeries or surgeries that need much intervention from our senior surgeons, it has a cost. So we cannot eliminate much of the cost annually. But this is the intention of having this smart clinic model, is to come up with an affordable care model.
So where is it situated? The smart clinic, where is it going to be?
So we're starting first with Abuja and we're working on the funding where it will be at. Prove the concept, if it works well, then we can.
When we were discussing the motion, we were discussing about where you start, because first of all, we have a pilot one, we have the full success story after it. After the success, we will go to expand. And
Because if I may, sorry, because it needs huge training for the healthcare staff. You need to be trained it needs technology, and they need to be trained how to use this technology, how to connect with the doctors and the consultants remotely and so on.
And this training will be provided by
Sorry, what I asking is how do you, are you using that does not have an
your
app?
agency.
Trust me. No, something. These are you guys don't have an app where you just you don't have the app on your phone, then you just connect, or how is it going to work? Because you just keep saying smart.
The application.
How is it going to work?
Yeah.
So the
It works
application
through an
or
app. It works through an app, and the app keeps connecting the patient with the healthcare system and healthcare provider. So the patient can have access to their investigations, their lab results, their radiology, their images, their medications, their appointments, their history. This is coming next. And then the patient can connect with specialists remotely.
Just 2 days ago, I had a Zoom visit with Tanzania, for example, that you directly reach the specialist. And this is not so expensive. I don't know what they charge. I think it's a third of the normal consultation. Is a Zoom call.
And the most important, they didn't have to travel.
Yeah.
So even only cutting the cost of the trade and the visa,
The model does work on a Zoom or a face-to-face consultation, plus connected health devices. So you can do ultrasound remotely. The nurse can put the small machine on the patient and transmit the images to the doctor sitting somewhere else. The cardiologist can listen to the patient's heart. While the patient is in a different area and can say, okay, this patient, we can do an ECG and he can have an electrocardiogram. Okay, and then the doctor can see it. So everything, until now technology did not provide everything, but most of the things that can be done in a physical concept can be done with this model. So it reduces the cost, it improves the access, and it provides high quality.
If I may just add one small thing, our work here and our focus as the partners of Fakeeh Nigeria is to customize this solution.
Adapted to the Nigerian
Exactly.
ecosystem.
Exactly. So when, for example, when we have in rural areas, we have a big, large segment of people who might not have even access to internet or smartphones. We will provide them with a clinic that they can easily access, and we will have the training for the paramedic at this clinic. So they will have the access to the public smart clinic through something close to them. This is our work, as we are the partners on ground. So what we are doing, Fakeeh is helping us with with the know-how, with the digital solution. Our work now on ground, together with our brothers and sisters in Nigeria and the government of Nigeria, that you are and you will sponsor us. We know that we will help each other. We will provide some, and you will provide other parts of the solution. So we can come together with a solution that can help the whole country. It needs and requires all of our efforts, not only one part. Even if the investment is there, even if the smart clinic is there, we need all our efforts to come together. We get the know-how, which is costing a lot of money. And to say this in this conference, um, most people, and even most of the companies all around the world, are not giving this kind of digital solutions for less cost. So even if the cost after all of the unit is $1, they will say that we invested in R&D $1 billion. So we will sell it for $5,000. Now in Fakeeh, now we don't have this argument. No, they are supporting us. They are, even as Professor Ove mentioned, they are providing this solution in less than the normal consultation price. So we need to collaborate, all of us, in delivering this.
In terms of collaboration, okay, I think that's a question. In terms of collaboration, how much of the buy-in of the government are you getting?
How much of?
Buy-in of the government? How are they buying into this idea? How much support are you getting from the Nigerian government?
Actually, as I said before, we are not yet in the let's say the practical phase, so I can answer this question in figures. But what I can tell you from what we saw today together, what we had in our event, Mr. President, Special Advisor for Public Health, and she was representing Mr. Vice President, His Excellency, in our event. They showed full commitment to support what Fakeeh is doing here and what Fakeeh is going to do in the next stage. This commitment showed us the strong support of the presidency of Nigeria and all the ministries and organizations. We have many ministries, the Ministry of Foreign Affairs, the Ministry of Health, the Ministry of Housing. Many ministries showed their direct support to what we are intending to do. So we are optimistic about having all the needed support from the government, because we are doing something. We are not asking for money from the government. We are offering our help, and we are offering reducing the cost of healthcare in Nigeria, and even for Nigerians who are traveling for medical trips. We are offering them something that they can reduce the So this is the services that we are doing for example, many surgeries cannot be done in Nigeria right now. So at least when people want also to travel for getting their treatment or their surgeries, we can facilitate their visas, we can facilitate their movement, and we can have a very good and let's say affordable as much as we can price for that. So we are doing what we can. After all, we are not a government; we are a private sector. So we are collaborating with the community to have the best results.
Maybe to comment on this one, patients who will need to travel for seeking medical treatment in breast they will have access to international patient visas. In this, there is a coordinator who will be taking care of the whole journey, from the visas to the transportation, accommodation, all the arrangements, so that not only they have peace of mind in terms of the actual clinical care, but also in terms of the whole journey, because we know that it's stressful enough for someone to sit treating at home. So our team will be working to make this as smooth as it can be, as part of our
I know that the visa can be issued directly.
visa, all the logistics. There will be a dedicated team who take care of all this logistics to make sure that the patient experience part is taken care of as much as the clinical part is taken care of. Thank you. Thank you so much.
Facility that's
Thank you.